disusul Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Masuk kali ya, Recording. Recording in progress.
Hello.
Hello, Professor Cordia.
Hi, can you hear me?
Hi. Yes, clear.
You can hear me?
Okay.
And you can see
Yes,
me?
I can hear you.
Yeah.
Yes,
How about
yes.
you can see me, right? Yeah. I'll share the screen with you.
Okay. Okay, Professor Cordia, you can start
Yes,
the share screen.
I did. I pushed the share screen, but you disabled me. Do you have to give me some?
Yes, we already give you
okay, good.
permission
Now can you
to
see?
share the screen. Okay.
Okay, can you see my screen? Can you see my screen? Hello?
Yes,
we can.
Cordia.
Okay.
Yes.
Good. Okay.
Prof. Cordia, do you mind we open this session with the opening ceremony first?
Okay.
Okay, I will stop the share screen.
So should I stop sharing?
Yes, please.
Okay, I have to figure out how to do it again, right? Okay, so I would get out of share. Stop sharing.
Okay, perfect. Thank you, Prof. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, welcome to the guest lecture Wordcast Professor 2021 under the title Global Health Security in the Era of Climate Change and Pandemic, Friday, October 8, 2021. Ladies and gentlemen, this event organized by Faculty of Medicine, Universitas Syiah Kuala. In this remarkable guest lecture, we shall have Prof. Cordia as our guest lecturer. Good afternoon, Prof. Cordia.
Hello?
Yes.
Yes.
And before we
So-
start, let's
Yes.
take a second to pray and hope that our event can be successful without any obstacle.
So
pray.
now I need to share the screen again, right?
One moment, Prof. Ladies and gentlemen, our guest lecture will be opened by Vice Dean of Faculty of Medicine, Universitas Syiah Kuala,
Okay.
Dr. Safiza Rahman.
Yeah.
For Dr. Safiza Rahman, the time and floor is yours.
Okay, hello everybody. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon and welcome to this virtual guest lectures. First of all, I would like to say that actually Professor Maimun Sukri, our dean, is really hope that he can join this guest lectures, but unfortunately there is any other task, that any other things that he has to attend, that he asked me to join this meeting and open these guest lectures. On behalf of the Faculty of Medicine of University of Syiah Kuala, we wish to extend our warm welcome to all participants, and special for our guest speaker, Professor Cordia from Griffith University. Thank you for your support for us and your continued commitment to building capacity of our faculty member and students. This is very much valued and appreciated. I hope we could strengthen our partnerships and continuing our excellent collaborations. As we know that climate change will have a significant impact of the health for the million people, and it is already starting to affect us. 1 million of people died from air population, severe weathers, and also zoonotic disease. That death rate will be continue to climb as the global temperature rises. The problem will be worse by climate change, which will be make vulnerable people even more susceptible to infection disease. Today, we're facing a pandemic, COVID-19. It has already shown us that the weakness of our global health system, in order to have better global health security, we must protect and strengthen our public health system so that we can prevent and fight health threats both by climate change. The COVID-19 is very powerful, demonstrate that an important primary health care as our foundation of both global health security and universal health coverage. We really hope today in this guest lectures, Professor Cordia will give us a new perspective of way to us to facing this climate change, and also global health security to increase our health system. And will be a good opportunity also for all of the medical students to improve your knowledge on, especially for the climate change. Thank you very much. Once again, thank you very much, special for Professor Cordia. Maybe today we have online meeting by your virtual guest lectures, but someday we hope you can come to Aceh and we have another guest lectures, but not virtual, but we can together in one big room discuss further about what is the issue that maybe we can facing after the pandemic COVID-19. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Safizur Rahman. And then we should take a picture. We shall have 3 times for this picture taken. We really hope that all of us can open up the camera, if you guys don't mind. One, two, three. This way. Okay, another one. 1, 2, 3. Oh, we shall have 4 times here. Okay, 1, 2, 3. Okay. 1, 2, 3. And last one. 1, 3, 1, 2, 3. Okay, thank you very much, ladies and gentlemen. Let me introduce you. There's going to be one lecture by Prof. Cordia, Bachelor of Science, MA, Ph.D. as the Director of Center for Environment and Population Health from Griffith University, Australia. And as moderator, we shall have Dr. Rina Sudani Oktari, Magister SCAP, Magister of Science. With the further ado, I'm going to give the times and the floor for our moderator, Dr. Rina Sudani Oktari. Thank you. The floor is yours.
Okay, thank you very much, Imam. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and welcome everyone. Thank you for joining us for today's guest lectures, especially for Professor Cordia. Welcome. We are so glad that you could be here today to share your experience and knowledge on the global health security in the era of climate change and pandemic. And thank you for our Vice Dean, Dr. Safizur, for being today with us. And thank you for all the participants, especially our medical students and others from university lecturers and students. Okay, before we start our guest lectures, let me introduce about Professor Cordia. Professor Cordia is the director of the Center for Environment and Population Health at Griffith University. She has a degree in medical anthropology and sociology, and her key areas of research expertise including global health, eco-friendly healthy settings, and then reproductive health, health promotions and integrated health planning, workplace health promotions and safety management, community need assessment, and policy development. She is committed to translational research and capacity building, particularly in linking environment and then health strategies and sustainable development, and has been active as an international consultant to facilitate the development of sustainable healthy cities, hospitals, and workplaces in many countries in the Asia Pacific. Her recent focus is on building a research consortium for One Health, global health security, climate actions, and sustainability. She has been awarded the member of the Order of Australian in 2013, and she has published over 200 articles and book chapters, delivered 2 policy or guidelines, and 4 commissioned research communications booklets, 5 documentaries, films, 21 international consultancy reports, 1 WHO regional guideline, and has presented over 80 keynote addresses in conferences. She has graduated 42 PhDs and has won a national commendation for 2018 Excellence in Research Supervisions by the Australian Council for Graduate Research. So today, she will deliver her keynote speech on the global health security in the era of climate change and pandemic. So for the participants, if you have any questions during the presentations, please type them into the chat box in the Zoom anytime, and we will collect this and address them during the Q&A sessions at the end of today's presentations. Okay, let's get straight into the contents. I would like to invite Professor Cordia to deliver your speech.
Good. Thank you very much. Now I need to share my screen. And as well, first, you see the gorgeous jacaranda behind me. This is our jacaranda season. So welcome to Brisbane. Next time, this time of year, you can see the purple tree there. But for our students, they may be a bit worried because when they see this tree, that's their examination time. So it's a mixed, beautiful surrounding, but you have to take exam. Okay, now I'd like to share my, can you see my screen? I'd like to share. Is that okay? You see my screen? Okay.
Okay.
So may I start? Yeah. So the topic, as you can see, is about global health security in the era of pandemic and climate change. So just to let you know that that will be the three areas I'll be talking about today, starting with introducing our center. Don't worry about all those words, but just to let you see that we have quite a few Indonesian here. And we still have some haven't been able to return because of lockdown. This is the kind of work we do, from climate change to disaster, to gender and reproductive health, and grounded in the reality of settings like cities, hospital, communities, and workplaces, and so on. So just to give you a little background from which I'll be speaking about. So today I will talk about, begin with, I would say the rising concern over global health security and why is it so worrying today. Then I will look at two aspects of major challenges ahead of our global health security, from emerging zoonotic diseases and climate change. So the two aspects I'll be discussing. And then, really important, what lessons can we learn from COVID-19 response to prepare for the next pandemic? And then I will forecasting the future and then say that we need to have a one well, one health way to prepare for the future global health security threats. Okay, so now when we talk about human security, and from that concern, basically as well as human existence. But now, our major concern really focus on, particularly the last decade, global health security. So what basically it means protection from threat to health. But one central message, really important, is globalized risk. There's no boundary between countries. The risk is everybody will share, but also we share globalized response, and that nobody can be completely safe until we have a globalized response and then safety. So that is the underlying message. Traditionally, security concern is about war and conflict. And then you can see that that is really a lot of countries majorly spending their time on. Until increasingly, we see epidemic have increased over time and global health security risks are increasing. And that basically, we can now see the natural traditional security from war and conflict to natural disaster like flood, cyclone, drought, earthquake, to the non-traditional one, health security, And then I will be mainly concentrating on infectious disease outbreak, given that we are now faced with pandemic. The definition about global health security from WHO, we have earlier definition, but in 2019, it said that global health security is defined as the activities required to minimize the danger and impact of acute public health events that endanger the collective health of populations living across geographical region and international boundaries. So basically, we have no boundary for disease. They were just really globalized risk. We need a worldwide strategy and effort to strengthen countries' health capacity to manage health threat. And the impact of pandemic, now we can really thoroughly feel that's increasing over time. Disease outbreaks are on the rise, but so are the economic and social impacts. And health, economic, and social impact of global health security is not just about the health system, but for example, the tourism, the travel industry, the transport, we can see the whole society have been impacted. And if you look at the economic impact of selected infectious disease, and that by the time we reach SARS, we can already calculate a very, very heavy toll. But of course, COVID brings to the new height. And that's one of the reasons is why it's a rising concern for the whole world. And that there are lots of lessons, even starting from the Ebola to today, of course, COVID. Now, what are the major challenges ahead of our global health security? So let's just look at these two major aspects. One is about environmental degradation and climate change. And the other one I will talk about next following will be emerging and re-emerging infectious disease outbreak. So scientific work have collectively informed a lot of evidence about climate change health and environment, and then also informing policy direction. So we say mounting evidence about climate change impact that would jeopardize our common future. We're talking about sustainable future. We have a lot of evidence to show that human greenhouse gas emission has increased so much since industrialized time that the growth rate by 2008 was at 3.4%. And then it's 41% above the 1990 level. And that was really alarming. And there's so much evidence to show that these are the impacts. So you can see from our industrial development to deforestation and the whole range of issues, including sea level rise, are happening. This is a very famous picture signifying global warming. And you can see the whole globe is heating up. The harder it is, the darker the color. Now, global warming by 2100, if we limit our emission, then we hope that we can limit to 2.1 degree Celsius. And then with the second scenario is not so good, is that get to 2.7. But if we have no mitigation at all, then this is what we're going to face with 2.4 to 6.4 C. You can see that the world is not quite habitable. If that's the case, everybody's in danger. Now you may ask, 1.5 degree is what we're aiming for all this World Conference now. Versus 2 degree, what difference does that make? Even this morning in Brisbane to tonight, there will be a degree, about 8 degree difference. Now that kind of day-to-day is weather, right? What we're talking about is a long-term, over 30 year, over 50, 100 year, that kind of average. Just to give you some perspective, 20,000 years ago with the Ice Age to now, we're talking about within 5 degree increase, 20,000 years. It's the last 50 years that we really escalated with our industrial development and technological advances. So what does that really mean? If we can remain at 1.5 degree, the global warming temperature, we will see more heat wave, more flood, more drought. 90% of reef coral would be lost, damage to crops and fisheries, and threat to global economic growth. But if we can avoid 2.6 degree, we will protect 10.4 million people from sea level rise. We will halve the number of the people without enough fresh water. We will reduce death and disease from heat wave, and we can make it feasible to deliver many of our UN Sustainable Development Goals, and that matters. Okay, but the last IPCC intergovernmental report, climate change report, about aiming at 1.5 degree level with policy advice is not looking good. Based on the current policies, we could experience global warming to more than 3 degrees. And that will be really, really disastrous. And that we're looking at the reality check at COP24, 2018. So from now on, what I give you will be evidence from 2018, because this is the crunching point for the world. So what happened? Carbon dioxide, 40% higher than pre-industrial time. Human activity causing most of the warming, and Earth's surface warmed, heat wave, heavy rain, ice has declined, and then the sea level is expected to rise. And that's sort of many coastal cities are in great danger, right? So if we're talking about the 24, they agree on the Paris Agreement, and that sounds good, except by, look at what we are looking at that meeting, the world meeting, the good part, the youth starting to be concerned. They starting voice their opinion and protesting, demanding climate action. Pacific Islanders start having interject into the dialogue, and then lots of civil society, health sector, amazing presentation in that conference. The youth were presenting and protesting outside. But the bad is that we failure to agree to welcome the IPCC 1.5 report. And then representation from the fossil fuel industry was very strong, and a complete lack of ambition. And then Australia promote gas as a climate solution. And it is the only nation to join the United States at pro-coal event at COP24 climate talk. And I'm saying that I'm quite ashamed about that. And that's the best thing. And so for that, you can see that Time magazine, which reaching to the whole world, has devoted a whole issue focusing on the fight for Earth. It says that by 2050, the year by which we must have already acted to have any chance of keeping average global warming to 1.5 degree above 19th century level. And scientists agree that the effect of climate change would be extreme weather, rising sea, wildfire, a deepening refugee crisis will be even more disastrous. So this is actually really concerning by 2019. And in fact, the Australian Medical Association first time declares climate change a health emergency. You can see the youth were very actively lobbying there in that conferences, and that health emergency we will see. So Climate Action 2019, every month there are movement, they are gathering in the world, calling for decision maker to trying to reduce emission, trying to keep to our goal about stopping at 1.5 and then reduce. And that by December, and you can see that that conference will lead to next climate talk at COP25. That was a disappointment. Australia gets special mention, not an honorable mention. At the same time, Australia is actually alongside with the US, and they were the one who were not showing the kind of ambition only a handful of a party actually point to this disagreement since a Paris Agreement. And this is the phrase probably made famous now, is say the science is clear, but the science has been ignored. And this is COP25. And that we are very, very worried situation. Now, when the Australian would fail to sign the big commitment, Australia is burning. Australia in 2009, April, start having lots of bushfire, and then they continue, linger on until later month, even worse. From flood to heat wave to bushfire, frequency, intensity, and duration of natural disaster in Australia is increasing. And our health system are struggling to cope, as the health expert predicted. And already Australia, the bushfire already emitted 250 million tons of CO2, half of country's annual emission just on that, by that time, just on the bushfire alone. So, and meanwhile, the global warming, we already projected future heat wave and heavy precipitation events will become more frequent, more intense over many, many areas. Now, Japan, for the first time in July 2018, declared this heat wave as disaster because more than 22,000 people have taken to hospital with heat stroke. Half of them are elderly. Where else is also suffering? Greece, Norway, Canada, UK, Southern California, and you name it. Just give you some example. The Canada, across that, with at least 70 deaths in Quebec. Heat wave in Southern California saw record-breaking temperature in some area, including a sweltering 48.9 degree in Chino, outside Los Angeles. And that also sometimes linked to a lot of bushfire as well. But look at Africa, the hottest ever recorded temperature was registered on 1st of July, 51.3 degree. So that is these are the images, because I don't have time to present. The evidence are plenty. So there are the water and food shortage and air pollution. And the air pollution will lead to asthma. And you can see that the passing emerging global health threat from climate extreme to flood to drought to water and food security issue. And then even, of course, the animal, plants, they all suffer. And then these are the very treacherous historical statue. They were under threat with the unprecedented flood. So you will always hear unprecedented flood, unprecedented heat wave. This, we're going to hear more and more unprecedented because that world is in a crossroad. So when workplace, some workers are suffering from even more heat wave double problem. So this sum up the kind of problem that we are facing in the world. Extreme climatic events, if it's not too hot, then it's too cold. If it's not too dry, then it's too wet due to the flood. Warming, and then it displaces many people because their livelihood, they cannot continue. They have to be displacement and resettle somewhere else. So you can see flood and also emerging more and more infectious disease as well. So now this is the kind of work that our center, our Facebook, our member, their research are on. Every single of those pictures, we have a research topic, one of this, people dealing with it, from thinking, yeah, you can see to those who have asthma, air pollution, and so on. So that sums up the kind of health impact that we have to deal with. But this is the warning that our center take it very seriously. Even starting in 2007, we already project that climate change will exacerbate the frequency and intensity of hydrometeorological disasters. So we can see what most of the disaster, particular weather event, and it will be increasing. And that will stress the healthcare facility and emergency service stretch to the limit in many countries, particularly the poor country. So that's no wonder climate change was declared the biggest global health threat of the 21st century. And as early as 2007, but a lot of people still don't take it serious enough, particularly the policy maker. So from environmental degradation, which is a big background for human future, let's focus on emerging and emerging infectious disease outbreak. And that we are living in a changing world. We are so connected, globalized. Our air travel, all this are now talking to you through this Zoom is new. But they also come with it is a burst of new age infections, new and re-emergent of the infectious disease. A burst of old and new age infection. And some of the re-emerging infectious disease like TB with different, more returning the vengeance, and also the polio and so on. And every hour, 1,500 people worldwide die of an old and new infectious disease, but more than that, half of them, of course, are children. The poorer suffer from, let's say, TB, among that increasing suffering, increasing. That's why we have the Global Fund plan and dealing with the TB, HIV/AIDS also. Then let's just look at from 2002 to 2015, there are increasing infectious disease outbreak, some new, some emerging, some old. But what really alarming is that animal disease transmits to human. It has always been, but of the 14 new infectious disease, 61% are transmitted from animal across species. But of the 175 new infections, 75% from animal. So this is what we are talking about, the growing worldwide threat from zoonotic diseases, and that from anthrax to Zika to Nepal to Hendra, which we pass on the back to the horse in Australia, pandemic threats are increasing. It's not a question about whether or not, it's about I'm hearing a lot of interference of the sound. So can you ask some of the participants to turn off their mic? Because it's very disturbing to me, very loud. Right. Okay, so now we see emerging and re-emerging infections, 70% of the vector-borne or zoonotics that we can see around the world. And that these are but we also start seeing antimicrobial resistant threats, which is also very alarming. And so the new age of infectious disease, which triggered by environmental, economic, social, scientific changes, helped to trigger an unprecedented explosion of more than 35 new infectious diseases in the last 30 years. So I'm sure you're familiar with the mosquitoes, with the bird flu, and now we're talking about the COVID. And this is H5N1, H1N1, H3N2, H7N9 continue. Now we're talking about COVID-19. And indeed, welcome to the big time. We are, for the first time, the whole world, we're seeing day-to-day, minute-to-minute cases evolving for this. So let's focus on COVID. We learned a lot. The last 2 years, basically, COVID taught the world a big lesson. But what lesson must we learn from COVID response to prepare for the next pandemic? Believe me, maybe around the corner, maybe we can avert it to much longer time, but we always have to be prepared. So are we ready for the next pandemic? Actually, in 2017, the Times Magazine already warning, say that we are not ready for the next pandemic. Okay, so the current COVID situation demonstrates just how unprepared the world is for the pandemic. So we saw the old, the good, the bad, and the shocking reality. We have good thing, the knowledge sharing and the real-time data, the big data through the web, through what we are now the connected, make the world learn a lot quickly about the pandemic and from each other. The bad thing is that the pandemic, the politics, the confusion, the racism, the inequality make the world a more dangerous place to live. But there's a shocking reality. The world can see the sick, the death, the mass grave, the burning of the body, the global panic, and socioeconomic costs. Now, it is this kind of database. We have minute to minute about case increase, okay, global death at the state level. If you dot that in any of that, you have the detail. This is Johns Hopkins, but there are more. We also see all this just at our hand. We just drop that. We just on a computer, we can see day-to-day sharing of information, knowledge, and real-time data. We can learn so much about social distancing, networking, and we can now see in front of our own eyes what the threatening of the curve, flattening of the curve means in public health defense, and then in the science of risk management. And so that's good. We learn so much. What are the bad? Well, we basically, we say, let's sound up again. Okay, so we prepare for the possibility of a pandemic. We must not fear, not rumors. We must have the world solidarity. But what is in fact what we were witnessing? The country ill prepared for the pandemic. Health system cannot cope. Lack of basic equipment and supplies, even lack of masks, personal protective equipment, ventilator, medicine for treatment, endangering health workers. But there were more alarming: social unrest, fear, panic buying, hoarding, misinformation, confusion, rumor, the infodemic, and increased divisions, racial discrimination, scapegoating, violent behavior. The world became a very much more dangerous world to live in. And that is really, really worrying. So when you talk about this other picture, we're fighting two pandemics, right? The pandemic and the infodemic, the misinformation. You can see the picture of this. But even in Australia, even toilet paper, people are start hoarding in the early days. And of course, poor leadership to give out misinformation and confusion is part of the shocking reality. Look at the red and look at those pictures, not good. So what is the reality? Real-time data on 28 September. I could have using today, but day-to-day, minute-to-minute change anyway. Just show you this kind of pattern. Confirmed case in 188 countries in the world. So that is the global debt. That's the global cases. This is really, we see it in front of our eyes, ticking, more. But what good practice can we learn from COVID-19 response around the world so we can be better prepared? Well, I can give you 3 points. First, I like to show you what confirmed that is proven public health measure work in emergency crisis management. But I can also show you what contrasts to what we believe about capacity, about health security, and how can we improve that. The third one is what are the new discovery. The previous paper, previous publication haven't prepared us for that at all. The importance of leadership, communication, and collaboration for the success or failure of pandemic response. Well, you are public health, those for the medical student and the public health personnel, you should know about this kind of good practices. Risk assessment and comprehensive risk management. This is the science of risk assessment and risk management. We need to do better. This work we know. Early intervention always work. We need to do mitigation and preparedness better, not waiting the case come out. And then vigorous testing, fever clinic to screen the patients, using the latest IT technology. We find some places using drone to disperse crowd formation. Contact tracing, that become a very important. It's a field epidemiology in practice, and we're adding all kinds of new technology. This is very important. Hygiene measures, physical distancing and social restrictions, and risk communication as an integral part of risk and crisis management. Here we now have vaccine, but what happened? We also faced with vaccine hesitancy. What kind of a management strategy do we have? So this practices confirm that the proven public health measures work in emergency and crisis management. And so if the world does not see public health importance, they better rethink. So we do have lots of the behavioral guidelines and all these, and already now displayed that is really important. We're now learning better about how to using simple statistics to explain to people what's happening and make it more appealing. And we also now learn to really plan well, roadmap to COVID safe. Before we let out the restriction, what is the step 1? What are the step 2? What are the step 3? Now that's really important to plan out and then to administrate it, to protect the whole of society. And then meanwhile, population-based testing, enhancing ability to detect, contact the confirmed case, and the local health system respond, but also must be strengthening that local health system to respond to it. Now, these are the kind of thing we learn. Now, what's contrasting to what we believe about the capacity of health security? Well, there's a global health security index score. We actually tick the box and measuring. So on top of the list, which is the US, the UK, and the Australia and Canada sort of on the next tier. And then you can see the China and India way down there. So that means that they're most safe, they're most secure, and they're not so quite so secure. So what is happening? Exactly the opposite. So you can see top of the list, the most safe country had the highest death, highest spread. India, Brazil, and UK also on top of the list. What happened? Indonesia is down there, and Israel. The reason I bring that up is that they have the highest vaccine rate. By April, by June, they were about 4,000 or 5,000 dead, but then now in the surge of the cases and then increasing death again. So do you think vaccine can solve all problems? No, think again. However, it's still the most useful, important way of reducing death. So the health security index predict the world in general was not well prepared, but what we think was well prepared for the world, we need to measure, and so that we can develop better. So what we're actually seeing that is some of those good practices in green. New Zealand can see that, and then in Queensland, the state I lived in. So when you look at Australia in total, it's different by state because they're different way of response. So Queensland mounted excellent response, while the other states were very different. So what are the emergency management? The process of developing and implementing policy that are concerned with 4 stages, right? For mitigation, preparation, response, and recovery. So this kind of 4 phases of emergency management. We know that even from preparedness, we need planning coordination really well. We need good communication. And if we're talking about planning coordination, we need coordination, we need communication. Those are so to lead us to the whole of society approach to pandemic preparedness. So you look at the aim of risk communication is to help stakeholders define risk, identify hazard, assess vulnerability, and promote community resilience, then promoting the capacity to cope with an unfolding public health emergency. So we need a risk communication strategy to communicate information and to stakeholders and making everybody working together. Relationship about risk assessment. And then before you can see now is looking at more risk analysis framework, the risk management rely on risk assessment and risk communication in a circular fashion. But how you communicate that is it really is in a circular continuous cycle. Should be way, let's say you want to curve the curve, you want to flatten the curve, you need to go ahead and then accomplish that. So the world is not shortage, have no shortage of this kind of major agency to talk about guideline about effective risk communication. these generally are good principles, but they still need more study to target it to most vulnerable population. This in general work, they're already there. And the key principle, these are also important, but we need to prepare normally before, not during the crisis. This is need the society to prepare those risk communication, credible source of information, and look at those principles, which also you can see that there are no shortage of publication. We have this publication, one of our PhD graduate now, they compare the SARS and H7N9, which is more deadly, but this one, actually SARS, has caused a big drama in the whole world. It's killing the travel agencies and all this, you can see, and then hauling all the herbal medicine and so on, and that much death. But let's look at the communication was quite poor. Early days were covered up and not transparent. All this impact on the whole society. Nobody know what to trust anymore. They learn from their experience. This is badly, but they keep that within the boundary of China. I think that's luckily. There need to be social stability. The government response need to be really spot on. So it was praised by the World Health Organization, say we're satisfied in principle the level of information shared, and we believe we have been kept fully updated on the situation. Now, that two cases show us the role of this communication and how it have a calm, scientific, evidence-based response to pandemic. We have no shortage of guidance, as I mentioned. Look at all this. But what happened? There's no evidence that COVID-19 response have learned from past good practices, particularly regarding the need for comprehensive risk management integrated with a risk communication strategy for pandemic response. Those good ones practice it, but majority, we don't see evidence of that. So what lesson must we learn? We have new discovery. What is the most important? We find leadership is really important, risk communication important, but the collaboration is also important. So when you talk about crisis principle leadership, you have to communicate, making the right decision, humanism, all this core value. So the quality of a good leader during a crisis are strategic, decisive, calm, goal-oriented, critical thinker, clear communication, ability to prioritize. And that's the leadership. So what good leaders look like during the pandemic? Now, what's instinctive when facing uncertain? Waiting for additional information, can't deciding, downplaying the threat, making lightly about, oh, don't believe it, and it will be over soon, doubling down to explain your action. So staying the course. So what needed in a crisis? Act with urgency, communication with transparency, taking responsibility and focusing on solving problem. And the same principle, similar principle of risk communication also apply for good leadership and the way they communicate. And if you ask the world, they will say the New Zealand, Jacinda Ardern is one of the very good leaders. You can see the way they responded, and that the cases, this is their population, very small population. They have confirmed case. This is up to 28th of September and 26th death. So that's considered very good. But I like to present to you that we, Queensland, doing very well too. We have larger population. We're also a tourist state. And then we have those confirmed cases and death, 7 cases. That is leaded by the Chief Health Officer. They did, as soon as they hear about China's cases, before any cases hit Australia, 6 weeks of solid heart and sweat preparation with the incident team. Everything is in place. So when we look at the good performance, so I'm very proud of lots of our alumni that the leadership fellow that we train them, including our emergency responses. For example, and the Guangdong provinces with 113 million people, they had 8 deaths by September 28th. And that in Shanghai, there were about 24 people registered 34 million around there. You can see that. But this one won the Australian China Alumni Award because you can see 58 million, zero debt. Very meticulous planning, very, very good execution. So these are our alumni who do the Australian alumni and the Filipino and so on. We are really sum up the good practice. And lots of them also start working with international body and sort of help as well. That's what we are proud of. This one particular, our current student, he's actually leading the Queensland team that I said is doing so well. He's now seconded to WHO to be the senior advisor or in the team about contact tracing. That's North alum. Now, there are many books start talking about this new discovery. We will never be the same again, but what may we hope we can face it better. They have a lot of the factors. Next to vaccine, the new technology about treatment is about leadership and communication. So this is actually discovered, but we are tailored to the leadership performance. Look at the UK, I will show you on the top of the list. And they're very, very difficult. Well, look at US, say, don't be afraid of COVID. Don't let it dominate your life. And that really, one of the common from the New England Journal of Medicine say, here in the United States, our leaders have taken a crisis and turned it into a tragedy. It's a tragedy in what happened in America today. India, and then when the first wave driving the migrant worker home without providing the transport adequate, millions upon millions of migrant workers forced to walk or cycle from the city area back to their village. Thousands die along the way. So, but meanwhile, religious function, no mass, people contact in the peak of the pandemic. So this is a situation we see in the world, and look at how stressed the system. 2 people sharing one bed in the ICT. So we actually may not know the exact number of death. You don't test, you may not have the number. Brazil, and this president say, don't be a sissy. All of us gonna die anyway. That sort of thing. So when I highlight these 3, because they share something in common. What are they doing in common? 1, their leaders have repeatedly dismissed and downplayed the coronavirus. 2, they have ridiculous public health guidelines, such as mask wearing. Become the enemy almost. And then they always give out false statement about the pandemic. And these 3 make them in common. Now, if we continue like this, with the confirm that we don't adapt readily, with the contrast, we still blindly trusted, and with the new discovery we don't act on, then what if? This is likely to happen. So we're now dropping, but it may return. It may return a bit milder, become the coast and live with human, but nevertheless, they're still dangerous. We can have to deal with that and for the future. So what future? Well, we have a long-term risk outlook that we look at infectious disease is really an important area, and a potential global catastrophe from pandemic pathogen will most likely have really a respiratory mode of transmission. And the urgent health challenge 2020, January, by whom, is that on top of the list, elevate health in the climate debate. So we must integrate health and disaster in the climate debate, linking together, joining force, and we must be stopping infectious disease. We need to prepare for the epidemic in the future. That's not easy because we know the driver of all the emergence from international air travel, we can't stop. Genetic changes in virus, well, we have to understand better. Increased urbanization, we can't stop. environmental and meteorological events, pesticide resistant, drug resistant TB is very important, human behavior. So all these complications, what can we do? And when we look at the factor, the underlying disease emergence and re-emergence, beyond the microbial agent, which many people focus on that, what is a zero case and what is it? And we know the human host have also lots of factors, but on top of the ecological environmental factors, climate and weather top the list, change of the ecosystem, so on, change the land use. And we know that. So what are we going to do? This is our 3 pillars in the past. We talk about preparedness and emergency response, risk management and risk communication, international surveillance and partnership. But we need to add climate change adaptation to better prepare for the future. And that's why I keep on saying link climate change adaptation with disaster risk reduction. Same for the global health security, contain known risks, respond to unexpected, improve preparedness, must rely on developing global partnership. And our PhD is now lecture looking at challenge opportunity for implementing One Health approach to address the emerging acute health security threat in Bangladesh. But now this is really going to be very important to understand the human environment, animal, and the interface of them. And so that really means that we have to bring many different academic field, different sector, working together, working locally, nationally, and globally to attain optimal health for people, domestic animal, wildlife, plants, and our environment. We must manage the environment better and understand the ecosystem better. And whole of society approach we must, because it concerns everybody. So you can see all these are the discipline, but what are we facing with in the umbrella? That still can be achieved if we are able to work together. We consider ourselves in one health and one world in one health. And now we have a movement called One Health Days, November 3rd. In fact, we may have some seminar activity if people want to turn on. These are the World One Health Day. In 2016, that's we started the first one, 2017, and the next one, that's 2019, we were working globally. This is at in Guangzhou. We're working with Sun Yat-sen University and a global expert gathered there to have a One Health conferences. And we believe that we will continue to run that. So One Health, the leadership, risk communication, and collaboration are key to facilitate One Health approach to prepare for the future pandemic and safeguard global health security. So with that, thank you for listening.
Thank you very much, Professor Cordia, for the very interesting and insightful presentations. I think most of our students has so many questions to be asked. So I welcome for the students, if you have any questions, you can open your microphone. Anyone?
So there are some questions I can see from the chat as well.
This is only for the
Yeah, nothing.
not the
Okay.
questions.
Please, yeah.
Okay. So any questions from our students or other participants? Anyone?
If you want to speak, you need to unmute.
Yeah, any questions? Maybe Intan, do you want to ask a question?
You can write it down also, maybe in the chat.
Yes.
And so on for the future.
Any question?
Okay.
Okay, Muhammad Gifari. Yes.
Okay.
Yes, go ahead.
Okay. I want to add something to Professor Cordia. In the lecture you have gave to us that say in the future we will face a new problem, something like emerging or something problem that they need, and also the climate change. Also there is about the leader responsibility toward this, but also based to us as the medical students who will be doctors in the futures, what we can do to prevent these things as individuals. And the second thing, what we can suggest to the leader that take a wrong responsibility. Because I think what happened to Donald Trump and what happened to Prime Minister of India, they also have a researchers, they also have a doctors who have a best suggestion to them, but they try to deny and try to not follow what the suggestion from the researchers of or the medical sector. So what we can do as the doctors, as an individuals, and what we can suggest to them, because we don't have enough power to manage the leader. Right, Prof. Cordia. Thank you. That is for me.
That is a very, very good question from the youth in general. And they sometimes feel powerless. That's why they protest, they get together. But the One Health approach also talk about you building your network, have a voice. Like in this kind of seminar, your voice is important. Your opinion are important. Now, it is true. This time, US and the media really show how ignorant some of those leadership practices are. They're ignoring the advice on public health and medical doctors. Meanwhile, we can also see in full view that medical doctor work so hard, the frontline worker, doctors and nurses, they risk their own life, really, basically, in a very fatigued situation. So I think using this kind of the image, I think you need to, we now looking at that, we call for you even network together, the voice your opinion and your voice, and then put in publication, put in your youth forum about what action you can you can act on. And we're now seeing that one of our PhD students actually working with the frontline worker, because they detected in COVID time, they're short of the PPE, they no mask, or using so much the personal equipment still not safe. They have developed different like acrylic window with the gloves going in. So they start developing new practices to protect the frontline worker. So in other words, if the doctor are students, you have to look into what are the health safety issues that you're confronted with. How about link the academic, link the other people together to use your research to address those problems. So your two-way, one is become good citizen, advocating for youth right, for climate action, and then look upon to public health measures as the science that we need to listen to rather than to be discarded. On the other hand, you are close to the center of the problem. You need to actually develop research question to how to address it. You alone may not be able to deal with that. So again, the networking will be very important. And I think you should start learning to build your networking skill, leadership skill, communication skill, network collaboration is your weapon for the future. You need to shape the society so that you can be heard, but you need to be part of the solution and be very, very sensitive about the kind of problem that how can you deal with, and then work with your principal, your supervisors, and the people who deal with the research team. Bring to them the problem and then work together to solve them. That's what we're encouraging our youth are doing that at the moment. They have hackathon, they have a different kind of forum, and then they actually take upon a problem and then they work on it in a group and then present it. And then we give them a competition so they can so become inventive, but the most useful one is that they become friends, they become working together, and they become from very pessimistic, saying, we have no power, our leader won't listen, becoming positively active participant. They have a voice, and your voice is very much needed. Believe me, that's your future. I don't know whether I answer your question, but it's a very good and a very big question.
Thank you very much, Professor Cordia. I think, yeah, this is a very good start for the youth to increase their role to prepare for future global health security issues. Okay, any other questions from the participants? Yes,
Yes.
Chut Putri, you can ask. You want to put in the chat or you can ask directly?
Yeah,
Please open your mic. Okay.
I will ask a professor directly. Thank you before for professor that give the lecture. Based on the lecture that you just given, I'm going to ask you. It's really actually it is one because in our country we have so many population here, and every day it increases. So what I'm going to ask is how to make uh, how to make, for example, health behavior it become routine. For example, like to make a good hygiene, especially for health, like washing hands and wearing mask for prevent respiratory disease. It is kind of routinity. So how to make activity become routinity, so it will be behavior, not only rules. It will be our behavior, our last behavior that we practice day by day. Thank you, Professor.
Good. Well, that relate back to the risk communication strategy and training. You need to develop a strategy targeted to different population. There will be ethnic minority, maybe speaking different language and culture. So what do they believe? So what kind of program you can develop to work with them together to build a strategy, rather than, it's not changing behavior is not as easy as you think. Staying to it is probably even harder. If you don't have the supportive environment to allow them to do it, and if you don't have the right policy, and if you don't have the culture that support that, so the health services go against it. If that's the case, then no matter what your individual behavior and belief would be, it won't work. So it is need to be a health promotion strategy that are comprehensive, but understanding the needs of your target population. It's not like the whole society, the middle class through media can do well if you're working with them well, but it is the one who are most vulnerable that you need to understand their need, and then analyzing in a multi-level way so you can have a strategy to manage it and to sustain it and to change the not only behavior, but policy and environment and the culture. That's what the most important weapon for changing people's behavior. Not about just give them a health education lesson. Not about just say, well, wash your hand. Not so simple. At crisis time is important. Like in the sink by the bathroom, there will be signs about 1, 2, 3. That will be useful at those times. But the long-term behavior and belief, it needs a whole society approach. I'm afraid that your health promotion and public health personnel should have a lot more research question to do with your country, your culture, and your island about it. And we have many students dealing with the risk communication, actually, from climate change to infectious disease to HIV prevention, all sorts of things. Yeah. A very good question. Yeah.
Thank you, Professor.
Okay, thank you very much, Professor Cordia and Chut Putri, for the questions. Maybe another one questions before we close our sessions. Anyone?
Excuse me, I would like to ask a question to the professor.
Okay, please, Jihan.
Okay, thank you. So professor, since we were talking about COVID, as we are still in the COVID pandemic as of now, I would like to know your thought about what do you think about herd immunity? Like, I personally knew of some people who, herd immunity is not unheard of, and it's there in practicality, it's there, and some people told me that like currently we knew that we need to get vaccinated. It helps with reducing the COVID number of patients that are being affected, but there are just some people who believe that, oh no, we don't need the vaccine because there is the herd immunity going on, and for people who already got vaccinated, and these people, you guys will be the one who are protecting us as the people who get vaccinated, while us, we don't really need to get vaccinated because you have been vaccinated, and you will act as the herd immunity for us, the people who don't get or, well, actually don't want to be vaccinated. How reliable is the herd immunity itself? Like, we from a disaster management point of view, is it really something that we can rely on in this pandemic situation, or actually we could try to somehow convince people that no, herd immunity is not as strong or as reliable as they might be, and like it's not the one-way solution for the pandemic that we are currently facing. I would like to hear your thoughts about that. Thank you, Professor.
Yes, it brings up a very, very good debate about immunity, and that I think that if you look at retrospectively, over time, when people describe that the lecture X one and when they disappear, that's because of immunity. Of the 7 coronavirus is linking to human, to at least 2 of them become a common cold, that sort of thing. They may say, but take how long? You would ask what evidence about how long, and at what price are you willing to pay? That means how many people you're willing to die, and then how much hospital get stressed out. That doesn't, not only that they cannot help COVID, they cannot help other diseases. The doctors and nurses, where your very, very important workforce are dying, and that the one with the non-communicable disease are short of workforce to help them with their regular checkup and maintain. So the immense impact just in front of our eyes. So is at what price, at what kind of evidence do you see that give us a time frame that you can say that, right? So it is not so easy, but what in front of us is easy to see is the hospital being stressed out as a resource, people are deaf and dying, and the socioeconomic costs are very, very immense. Those who actually handle it really well, let's say if you have a very strict restriction, acted promptly, and in fact, the economic come back much faster. And the long-term prosperity of the society is not as harmful as it is. It is also, always trying to play catching up and waving and yo-yoing, and then they will suffer longer term. And then you get people with the lockup fatigue, and lots of social unrest even more. So decisive measure need to go hand in hand beforehand with good risk communication. And you need to establish a good source of credible source of information. You need to have a well-planned strategy before the next pandemic, before the pandemic, not after the pandemic. And then you say we let out, and then we lock up down again, and then those are the worst. Very bad for people's psyche. And so you can expect now the next one, people going to spend 99% money go for vaccine, but they're still not going to be just solving the problem. What about the vaccine hesitancy? What about the commercial competition that causing all kinds of issues? You can expect that. So those are the things need to have a group of people together, actually in a way of planning for the next pandemic and emergency. And it's a must. And then you need to start with the youth from climate change issue as well, because that is about much greater at stake. Your children's will be at stake. So those two can come hand in hand, and you enhance your voice together.
Okay, thank you, Professor, for your thoughts.
Thank you.
Okay, thank you very much, Professor Cordia and Jihan, for the questions. Professor Cordia, is there anything else you want to cover before we wrap up? Any closing statement or?
No, I hope that was clear and that I hope that is useful.
Yes, thank you very much, Professor Cordia. If I can wrap up, there are so many things we have learned from today's guest lectures about the rising concern of the global health security, and then some challenges, and then regarding climate change and increasing disaster risk, and what lesson can we learn from the COVID-19 response. This is also very interesting that in 2017, it's already warned that we are not ready for the next pandemic. And we must act now to help countries prepare for that pandemic. This is the time for facts, not fear. This is the time for science, not rumors. And this is the time for solidarity, not stigma. And Professor Cordia also mentioned some of the good practices we can learn from the COVID-19 response around the world, including the comprehensive risk assessment and risk management, and then early interventions, including mitigations and preparedness, and then using IT technology, contact tracing, hygiene measures. And this is confirming that the proven public health measures work in emergency or crisis management. Also, Professor Cordia mentions about the importance of leadership and then communications and collaborations, and also the concept of One Health. This is also new for us in Universitas Syiah Kuala, because we just start initiating the One Health concept, especially in the students' curriculum. So this is one of the way to prepare for the future global health security issues. Okay, thank you very much, Professor Cordia.
Sorry, I have a last word then. For the medical student, maybe start working with the veterinarian student, with the public health student, thinking together. But also if people start questioning public health and they say, we can't afford it, there's no money, no budget. Instead, say that it's not the question whether you can afford to have a well-resourced, empowered, and smart public health workforce. The question is, can we afford not to have them? In the era of climate change and pandemic, you gather yourself the data and figure, and then you say, can we afford not to? So.
Thank you very much, Professor Cordia. This is very interesting topic that we learned today. And thank you, everyone. We really appreciate you being here. And then as part of the world-class professor, we still have some seminar and workshop, and we will share the information later. So just follow our updated informations. And thanks again for joining us today, and we'll see you next time. Good afternoon, and Assalamualaikum warahmatullahi wabarakatuh. And I will give the microphone to the MC.
Okay, thank you very much, Dr. Okta and Prof. Cordia, such a nice lecture. So, ladies and gentlemen, before we close our event today, let's take another picture, and we would love to have your we would like to have your picture along with the virtual background, and there is going to be a special picture here with this as the side of the picture. So we shall have Dira. Dira, are you with us, Dira? Yeah, Dira, please take a picture. Okay. Okay. On 3, 1, 2, 3. Okay. One more time. 1, 2, 3. Okay. Two picture with this on the side. There are 1, 2, 3. Okay. The last one. 1, 2, 3. Okay, thank you very much, ladies and gentlemen. Please kindly to fill out the attendance form that I sent in the chat room. And thank you very much for your time. We would like to inform you that this is not going to be the last of World Class Professor. We shall have another classes in the form of the seminars. If you want to know more about the information, we would like you to join our WhatsApp group for the information later. So, ladies and gentlemen, thank you very much. I'm Imam Maulana as the Master Ceremony. So, thank you for today. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Professor Cordia.